I've been doing this for 16 years.
Okay.
Before this, I was a paramedic and I worked in transplant.
Oh.
So I worked in the sick care side of the healthcare system and went to chiropractic school because I was like, there's got to be a way to keep people out of the hospital.
Mm-hmm.
And then my first job, I worked for a clinic that took insurance and was in the insurance sick care model. And I felt like I was on the other side of it, and it didn't really resonate with me until the last like 4 or 5 years that, wow, I'm just doing the same thing but without drugs or surgery. We were putting out fires and people were coming in for that.
Yeah.
So I've really been making this shift to be on the proactive, preventative side. Yeah, because I think chiropractic has a place in all of the spots, but its sweet spot is in prevention, in helping keep the body aligned. We just got our car back from the tire place, and he said, look, this is why your back rear tire keeps going out. They couldn't align it. The bolts are seized up. So you gotta fix this.
Yeah.
I was like, it's perfect timing for coming in here and talking about mobility. He's like, we can't align this, so get that fixed or you're gonna keep burning out tires. So that's very fitting. So one of the things when we talk about these general mobility classes is that if you want to reach up and do a big movement, or if you want to be able to squat down to pick something up, I call those are global movement patterns. They're the big pattern that your brain just puts all the pieces together and figures out. For that to go well, your shoulders, your hips, your knees all have to be able to move through most of their normal range of motion. But over the years, it tends to fill in the blanks. I usually don't get into a specific condition for somebody, but if you had an area of the body that you wanted to learn a little bit more about today, what would it be?
Oh, well, I've had troubles with the lower back, but it's pretty good lately. My goal in life is to be strong enough to get myself up if I fall to the phone, get to the phone. I try to be independent. I'm very, very careful on stairs, extremely careful stepping off a curb. I'm trying to stay healthy, well, capable, as long as I can.
Yeah, that's losing independence is
Yeah.
I think everybody's fear, and nobody talks about it until it starts to become a reality. And
And then you become, you're that far away from a broken hip, always.
Yeah.
Just that much.
You know somebody, you probably know multiple people who've
Lots
had,
of people.
Yeah. Everything that we do here is because of either myself, friends, or family injuries, or things that happened. My stepfather had diabetic neuropathy, lost a toe, and we saw the decline there with neuropathy. So we do a neuropathy protocol with people to help them, and it ultimately comes back to balance and quality of life. So we have a balance training program, so that's a big piece too. It's just being able to
fall.
So we don't fall. Or one of the ways that there's one thing to be able to balance, but can you pick up your foot and catch yourself so you don't go to the floor?
Right.
Or if you do, you go more gracefully than just the thud.
You don't want to face plant.
We don't want to face plant. We don't want to fall hard on the hip.
Yeah.
We want to even just be able to hit a couple things on the way down and land and bruise a knee.
Yeah.
And then be able to get up from there. So that's there's the optimal textbook way that, oh yeah, I'd love to be able to just get up that way. And then there's, let's figure out what you're working with and how to help you be better at getting up and down off the ground. So we might as well go through a little bit with pushing the hip back first versus just bending the knee. So even on one leg, use balance, and hip goes back first, like you're gonna close the car door, and then stand up. And hip back first, sit back, feel your hamstring, the back of your leg engaged. If you're on the floor, once you get over on your knees, how do you get up?
Right.
And here, and you got to here, hopefully to here, and then it's this.
Right.
And if there's nothing to grab onto,
It's hard.
it's here and it's pressing up.
Right.
But imagine falling and hurting a wrist and not being able to push. So being here and being able to get up without assistance is gonna.
That's exactly what I wanted.
So yeah, that's the start of you working on hip mobility and strength. one of the things that I often say here is that we need mobility, stability, and then strength. So right now, we looked at this movement, and it looks like mobility is probably okay. Stability needs a little work on the balance work, and then strength building on top of that. So, yeah, I think you're going to get your stability and your strength with that.
That's pretty good.
That's
fairly comfortable.
that's excellent. So this, we call this the shin box,
Uh-huh.
or 90-90 position. And this is a great way to work on range of motion in your hips and be comfortable being on the floor, because this is the position that you would get up from. So if you needed to get up right now, where would you go with your arms?
I'd go this way and get on my hands and knees.
That's perfect.
It's not pretty, but it's what I do.
That's the only way to go from here. I can't go this way. So I would do the same thing. I would go to here, and I just kind of come up onto this knee and get this leg around. Let's rock here. Sit back on your heel a little bit more there, or that one. Look up and put your hands on your right knee. All right. So we don't like to go to places that make us uncomfortable, right? You need to come here. Okay? So bring your phone down, put a chair next to you. Be okay being uncomfortable with the floor, because that's the fear avoidance, right? Like, you don't want to fall.
Right.
But to press into those areas that scare you in a safe way, you'll have the confidence to be able to get out of it,
And
right?
eventually the strength to do it.
And eventually the strength, we'll
Okay.
get the strength back. But if we don't sort of like challenge the fear of getting down here in a safe way, when it does happen, then you're really gonna panic.
I'm sure you're correct.
Yeah. Okay. So, and this is what when we do balance work here too, we encourage people to, show us the thing that scares you. Show us the thing you want to be able to do, because, like, if you don't work on it now, what's it going to be a year from now? Right?
Exactly.
But if you do work on it now,
Yeah.
you've got a yoga practice or something a year from now. So, I mean, none of us are guaranteed tomorrow. That would be I think a mobility and a core strength piece. So, at least once a day, I challenge you to get down there and do what we just did. Have a chair handy. You do want to use all your assets. It's a good play on words for using your glutes.
Yeah.
Use all your assets to get up. Yeah.
Okay.
Yep. And then getting up, we don't have to get to the floor again.
Okay.
So I think that's like three big takeaways for you to
Okay.
work on.
I can do that.
Yeah, and if you have sort of disclaimer here, you're not a patient, so
Yeah.
if there's something that comes up pain-wise or you're not comfortable, definitely work with your doctor,
Yeah.
orthopedic physical therapist.
If
But
it hurts, stop.
you could, I didn't ask you to do anything that you weren't able to do. Yeah, if it hurts, stop. And work on this for a little bit. And if there's anything down the road that you want help with,
Okay.
come on in, and you
Good.
talk to us as a team. But,
Good.
Yeah.
Cool.
Good.
Well, I appreciate